Welcome to the School Mental Health Minute. This is a weekly webcast that focuses on mental health and school issues for children and adolescents. We'll highlight some of the newest research findings and translate the impact and implications of these findings. All this in a couple of minutes. I'm Dan Florell, and let's see what this week's study has to offer. We're featuring a journal article this week titled Anxiety and Depression in Academic Performance, an exploration of the mediating factors of worry and working memory. The author's goal was to see if middle schoolers who have high levels of anxiety or depression have increases in test-specific worry that negatively impacts working memory. Confirming prior research, it was found that high levels of anxiety or depression lead to poorer performance on academic tests. In addition, the high levels of anxiety or depression had an indirect effect on students' academic performance. This occurred by increasing the level of worry students had about the test, which served to restrict their working memory capacity. In other words, the worry diminished the ability of the students to problem solve and do well on their tests. The takeaway is that high levels of anxiety or depression have a direct and indirect impact on poorer academic performance. Prevention programs in the schools should focus on using cognitive behavioral techniques to reduce anxiety and depressive symptoms, in addition to focusing on the cognitive component of worry. If this is done successfully, students will regain capacity in their working memory and should perform better academically. That concludes this webcast of the School Mental Health Minute. Come back next week, and thanks for watching.